Good morning everyone. We are Group 5 from Wednesday's NUR2223 class at Peninsula, and we're going to be exploring the importance of handover in the clinical environment and the potential issues that can arise through poor handover at Bluebird Hospital. Alongside me I have Sarah, Jerome, Alexis and V. Handover is critical in delivering safe patient-centred care as it is vital information and must be effectively communicated between health professionals for the patient. Reflecting upon the video Learning from Error, poor handover was a major contributing factor that led to the death of the patient through excessive miscommunication and misunderstanding. It is important we recognise this and learn from it. The National Safety and Quality Health Service standard the handover applies to is communicating for safety. This standard recognises the importance of effective communication and its role in supporting continuous, coordinated and safe patient-centred care. Effective communication through handover is crucial and involves everyone involved in the treating team. To decrease errors associated through handover at Bluebird Hospital in the future, it is important to create an aim statement for all allied health professionals to strive towards. In saying this, by the 30th of June 2019, the rate of healthcare errors associated with poor communication due to handover will be reduced by 20%.
Handover is a tool used to communicate valuable information about a patient and is important in ensuring continuity of care, patient safety and reducing patient harm. Handover enables patient safety to be maintained as it allows oncoming staff to be informed about the patient's current health status, their relevant history and key recommendations from the outgoing staff. This minimises misunderstandings and uncertainty for the oncoming staff and therefore reduces the risk of them performing errors that may result in harm to the patient. A complete handover is also important as it allows patient anxiety levels to be minimised. This is because the patients are assured that the oncoming staff are receiving the relevant and necessary information that enables them to determine a plan of care that allows the nurse to optimise the patient's health outcomes.
ISBA is a structured approach in delivering handover for healthcare staff. It enables effective communication regarding patients. ISBA refers to introduction / identification, situation, background, assessment, and request / recommendation. If used correctly, ISBA may improve communication within multidisciplinary teams. The ISBA tool should be used by all healthcare staff as it used to structure clinical communication and ensuring accurate handover of information between shifts. The ISBA framework can organize the information in a clear and a concise format, which includes a summary of the patient's medical history, illness history, pathophysiology, laboratory data, current situation, and nursing care information.
Measuring the success of ISBA during handover is a valuable fragment of our proposed intervention. Improvement methods and tools, which are commonly used for diagnosing and analysing problems and evaluating outcomes, are a way of measuring improvement. To measure whether proposed changes will be effective, we will be using a study tool named Statistical Process Control Chart. This particular tool is used for evaluating outcomes of proposed changes. It involves analysing how a process changes over time. Particular data is then plotted in order. It should have a central line, upper and lower control limits. The upper and lower lines are used to determine the data. The ultimate goal of our proposed change for the practice of handover is to improve patient safety, attempting to minimise miscommunication, medication errors, incorrect treatment, adverse events, including life-threatening, and increased length of stay, as these all can be a result of poor handover technique. Implementing the use of ISBA may also lower the clinical risks for healthcare professionals and also the organisations they are employed by.
After the implementation of the intervention, we're going to test the effectiveness of ISBA in handover to see if it improves the health outcome of patients. We will achieve this by having two wards as our experimental and control groups, implementing the mandatory use of ISBA in the experimental group whilst the control group is unchanged. In order to eliminate other variables as much as possible, these two chosen wards are supposed to be in the same hospital with similar employee number and acuity level. Data collection will be finished before the 30th of June 2019. We will be collecting the number of healthcare errors associated with poor communication that happened over the year by reviewing the investigation result and conclusions of each case. The stated data come from the Victoria Health Incident Management System, or VIMS. It is a statewide system of identifying, reporting, and analyzing adverse events. According to the severity of the event, different levels of investigations are carried out to find out the contributing factors of this event. Under the governance of Health Service Chief Executive Officer and Head of Department, policies are established to ensure the hospital has this kind of system in place and to ensure staff are supported in terms of incidents reporting. In order to gain access to this data, we need to cooperate with the clinical risk manager of this hospital. As the name suggests, the clinical risk manager is in charge of the adverse events and potential risks that occur in this hospital. For example, he or she ensures that investigations of adverse events are carried out effectively and appropriately. With the help of the manager, we can look at the factors to see if our intervention reduces the number of incidents related to poor communication. If the changes work, the numbers of incidents of the experimental group should be reduced compared to one of control group.
The effects of our implemented interventions can be measured in many ways. One measure that can be used to assess the effect of our interventions is the number of adverse events caused by poor communication and misunderstanding. An adverse event is any incident that results in unnecessary harm to the patient. If there is a decrease in the number of adverse events from 30th of June 2018 to 30th of June 2019, it may indicate that our interventions have improved the quality of handover. A second measure that can be used is the number of patient complaints about poor communication. A complaint is a statement which outlines that something is unsatisfactory. A decrease in the number of patient complaints from the 30th of June 2018 to the 30th of June 2019 may suggest the implemented changes have enhanced communication and understanding among health professionals. Lastly, a third measure that may be used is the number of surprises that staff encounter as they provide care to a patient. A surprise would be defined as any new information that the oncoming staff was unaware of as a result of poor communication and shared understanding during handover. A decrease in the number of surprises encountered by the oncoming staff would indicate that the interventions that have been implemented have enhanced shared understanding among healthcare professionals during handover.
Comparing pre-implementation and post-implementation data is a useful measure for handover improvement. Periodic analysis of evaluation data is required in order to revise the clinical handover solution in keeping with the principle of flexible standardization. Data should be collected at specific predefined interval, for example 3 monthly. Breakdowns at handover will not usually cause harm. It is beneficial to learn from adverse events involving handover when they do occur. When examining the handover, incident staff should consider if the handover improvement solution could be adapted to avoid or minimize the risk of the similar patient safety incidents occurring in the future. Within the clinical environment, there's often a regular turnover of staff. All staff must be provided with the relevant knowledge and skills on the organization handover practices prior to commencement of employment. Ongoing staff will also benefit from regular refresher courses in order to continue providing safe care and improving performance. Relevant research on clinical handover should also be made aware to all staff so they are able to update their current knowledge and skill and be provided with the sufficient training accordingly. It is important to have ongoing monitoring plan. So with the ongoing monitoring plan, the collection method we use survey or direct questioning of staff. For example, we can measure by percent of staff that understand the new process, and we can perform them after training 3 months, 6 months, and 12 months. Repeat after alteration to the new process. We can collection by observation, by measure the percent of handover complete according to new process, percent of handover interrupt, percent of handover without needed documentation. We can perform it weekly for first month and then monthly. With the collection method, we have survey and interview. We can interview participant and patient satisfaction. It can perform monthly.
We'd like to take the time now to thank you for watching our video on the importance of a complete handover.